Hello, welcome to the Ultimate Men's Movement podcast. I'm Jack Rocco, your host. Neil Haley has been double and triple booked today, so he is stepped away for the day. But I have a fantastic guest with me today. This is Susan Ritt. Susan Rich, MD. She's a physician and a psychiatrist outside of the DC area. We met about a year ago, Susan. Is that we're at least a year,
I
more or
guess it
less?
was. I could probably look and see when you signed my book. You didn't put the date on it, but
Oh yeah.
yes, I would
Yeah,
say
we don't need
you're
we don't
the
need we don't need fine details here. This isn't a medical record. We met about a year ago, and one of the great things about that I find about being an author is that you often run into other authors online and about the world. And Susan has written a book called The Silent Epidemic. It is about fetal alcohol spectrum disorder, which a lot of people, when you mention fetal alcohol syndrome, they think they understand it. But this is a little twist on that known entity. And what Susan has taught me is that fetal alcohol spectrum disorder is the iceberg that's under the water, that fetal alcohol syndrome is the thing that is most recognized, that is more easily recognized. There's some characteristic physical features and mental features. But the spectrum disorder that's under the water is often unrecognized, both by physicians, by parents, and often by the patient who's affected themselves. Welcome, Susan. Welcome to the Ultimate Men's Movement. I appreciate you coming and taking your time to talk about this with us.
Thank you so much. And I was really impressed with your work, Jack, and very delighted to be on this podcast because I know you're really moving the whole needle forward for men. And I think there is a lot to share about the issue of prenatal alcohol exposure and preconceptional alcohol use in couples, not just the female. So I'm excited to share more about that.
Yeah, thank you. Yeah, because when we first met, we started talking about each other's books. And I think we both recognized that my book was about, quote, adoption trauma and a lot of the characteristics and phenomenon that adoptees encounter. And I quickly recognized a lot of similarities between the two. There's once again, it can be subtle, it can be lifelong, often unrecognized, but a lot of the ramifications of, I would probably imagine, most childhood traumas. You're a psychiatrist, so you can speak to that better. But we quickly bonded with one another. We met on LinkedIn. And then I was taking a trip down to North Carolina. We met for a quick bite to eat. You were coming back from somewhere with your kids. And what was it? Was it Honduran or Venezuelan?
Oh, I think it was, we went to Costa Rica.
Costa Rica.
Yes.
No, the restaurant we met at a little.
Oh, yeah. We met up at a restaurant or something.
Yeah.
You're
So
right.
it was nice. We signed and exchanged books, and we've kept in contact. And I also I really appreciated, there we go. I really appreciated you had me on another podcast with Patricia
Patricia
Casper.
Casper. Yeah,
Right.
she's
Casper.
Living with FASD podcast. So we got together on that and shared the intersection between children who are adopted and those who are adopted who also have some degree of fetal alcohol spectrum disorder. Because
Right.
as many kids who are adopted may be relinquished by their biological parents because their parents have substance use issues and are unable to take care of them.
Mhm.
They end up testing positive for drugs and alcohol, and for whatever reason, the court system has decided to take the children away, and which then further traumatizes the parents and the children instead of getting women into treatment before they even get pregnant, which is really
Right.
the goal, the men and the women. And to share more about that. So the
Yeah.
intersection between the two sort of fields of adoption trauma and fetal alcohol spectrum disorder sort of research is really that children who are adopted are at a little bit higher risk, or maybe even a lot higher risk, of having some of these issues associated with prenatal alcohol exposure. And really,
Right.
it then becomes the two-hit phenomenon. So the first hit
Yeah.
between
Well, tell you what, Susan, let's back up a little bit. Let's go into the etiology of it and really define what fetal alcohol spectrum disorder is. Because you and I are both very aware of it, but let's get our audience up to speed. And I'll start the explanation as my simple orthopedic understanding of it. The way you explained it to me, that it is much more frequent than fetal alcohol syndrome. And when you hear about it, like, of course, why would mothers drink? And the scenario that you laid out, which happens frequently, is perhaps a young woman who's every weekend in college, binge drinking on weekends. She meets a boy, they have an encounter. It may be another 2, 3, 4 weeks until she's expecting her period, which then never comes, or maybe there's some spotting. She's maybe in denial. She's not certain that she's pregnant. So it slips her mind. And then it may be till the second period that she's missed where it becomes more obvious that, oh, hey, maybe I need to be tested. So now this is potentially a 6-week period where she's been continuing to drink, binge drink. And then the moment that she finds out that she's pregnant, she says, okay, I'm not drinking anymore. I'm pregnant. So a lot of people so the history of alcohol during the pregnancy may not even be present for some of these patients. However, a lot of the damage, or at least some degree of the damage, and that's why it's a spectrum disorder. And alcohol, as you and Patricia have taught me, affects every single organ system in the body. And I forget the number. You told me there were 200.
about 400 non-communicable illnesses associated with prenatal alcohol exposure. I want to go back for a second to something you said, in that it's not that the history of the pregnancy does not contain prenatal alcohol exposure. The history you're referring to is the physician who takes, or the health provider taking the notes
Right.
from the woman, and she will not realize that before pregnancy recognition, that is before she understood she was pregnant, that there was some use.
Yeah, that's exactly what I meant. It's not in her history. Yeah, it's in her history, but she doesn't report it as being in her history.
Yeah, and I've got to
Yeah.
be honest with you. I take very careful histories in my practice, and we're very careful in the childhood history to ask questions like, at what point in the pregnancy was the pregnancy diagnosed? At what point did you find out you're pregnant? Is there a possibility that there was some cigarette use before finding out? Was there any vaping? Was there any recreational drug use, prescription drugs? And
Of course.
then we ask, and it's a questionnaire, it's like a 9-page questionnaire. We ask very gently in the questionnaire, is it possible prior to pregnancy recognition that there was any alcohol use? And,
Right.
or I think the way it's phrased is, how much alcohol use was
Mhm.
there before?
Yeah, but what I guess my point being that most family practice physicians don't take a 9-page questionnaire when it
I
comes.
know that.
So you do, because you're seeing these patients 2, 3, 10, 20 years down the road. And then it
Right.
becomes, or they're undiagnosed, they have other issues. They may have they may have substance abuse issues. The point to me saying that is that it's often undiagnosed, unrecognized early before they get to you. So a lot of these patients are out in the community. And I remember the numbers you told me about, the number of incarcerated people.
So 1 in 20 people, just as a whole, the Centers for Disease Control and Prevention has that data, and the National Institutes on Alcohol Abuse and Alcoholism, they report it's 1 in 20. There are some researchers like Dr. Philip May out of University of North Carolina at Charlotte, who's reporting as the figures are about 1 in 10. They may be as high as 1 in 10. So that means there are plenty of people out there that don't know they're diagnosed. Even in the foster care and adoption community, there's a report by Dr. Ira Chasnoff out of Chicago saying that only a handful of the children in that realm are actually diagnosed. And there are a lot with misdiagnosis, meaning they're diagnosed with a lot of other things like autism, ADHD, what used to be called Asperger's, social communication disorder, learning disabilities, severe emotional dysregulation, And many of them then go on with these multiple diagnoses into their adult years without anybody ever having identified that prenatal alcohol exposure is the problem. And I don't know statistically how many people have with incarceration issues because no one has done systematic studies of those people who are incarcerated, but we do know that about 40 to 60% of people incarcerated have some degree of what we call in child psychiatry, neurodevelopmental issues. So either learning disabilities, ADHD, wide range of spectrumy conditions, and then those people who end up on death row, there's a colleague of mine who has out of University of Washington, Seattle, who has done many death penalty cases. I've worked on maybe 8 that we've gotten the death penalty overturned because of this, but she has seen, I think it's upwards of 60 or 70 people who have this condition on death row. And remember that she's only one individual who she's a neuropsychologist who sees people
Right. Yeah.
incarcerated. Now, I don't tend to see people in my practice with that, but I'm often asked by public offices of the public defenders in different states that have the death penalty. And here in Maryland, where I practice, I've seen juveniles and adults with all kinds of different criminal charges that
Right.
are that have this condition.
Yeah. I think the point being that like a fracture, it's easy to diagnose a fracture. You check an x-ray. It's easy to diagnose anemia. You check a blood count. With a lot of psychiatric illnesses and conditions, the diagnosis isn't straightforward. There's no one test you can do to do it. It takes often years for these pieces to come in. A child who may be nonverbal, child who may have problems with walking, a child who may have problems with kidneys, liver, any kind, like I said, because alcohol does affect every major organ, it's not a clear-cut diagnosis right away. And there's a lot of
Yeah.
patients who are misdiagnosed, but the prevalence of alcohol within our society and its use, especially in childbearing women and men, that it's much more common. It's hidden often under layers of other trauma. As you mentioned, if a family has a substance abuse disorder and alcohol is a part of that, it's awful. It's very hard because alcohol is accepted as socially acceptable. It's just a couple drinks.
Yeah, it's
I,
I call it our social drug of choice, but it's a solvent. It is a chemical. It is a chemical that you can store, let's say, tissue samples in for years. And remember, in research, we use alcohol to denature DNA. That's why it's a mutagen because it breaks the DNA. And
Mhm.
in development, when the eggs and sperm in the babies are developing, believe it or not, women are born with all their egg components. So the alcohol that's from the mother in the baby then is going to affect even the baby's ovaries and the eggs that baby produces. Fracturing DNA means then that it can be associated with certain cancer. Alcohol, we know, is a carcinogen. We know it's a mutagen, means it causes mutations. One of the reasons that it causes birth defects, like you can get kids with cleft lip and cleft palate, cerebral palsy that have prenatal alcohol exposure. And of course, not all the children who have these conditions are due to alcohol, but with alcohol being our social lubricant, it's sexual lubricant. Ironically, in early stages of pregnancy, and for men, even up to 3 months preconceptionally, it can cause problems. And
Yes, so it affects both the male and the female, which is,
yeah,
when you hear about the topic, you think about women's issue, don't drink during
always.
pregnancy.
Both women get thrown under the bus.
Men get thrown under the bus too, because we often are held responsible for the ramifications, whether that be financial or supportive to some extent. But just to bring it to the public's awareness that it does affect everyone. It is a men's issue as well.
It is a
You're,
men's issue.
yeah, if that it's going to affect your sperm cells, but also your children. And
Right.
also there's probably many men out there who have it who don't know they have it.
Right.
And it's one of these things I think it's a silent diagnosis. It's a silent And the last thing that anyone would think of, because you asked your mother, did you drink when you were pregnant? No, I didn't drink when I was pregnant. Meanwhile, they may have drank before they knew they were pregnant. So it's that little caveat that may not be available in the history, may not be available to the child or to the grown-up who did have alcohol exposure and just wasn't aware of it.
And for a long time, because this wasn't actually identified as a major issue until 1973. And really, it didn't get out to the lay public until the late 80s, when finally the US Congress kept pushing for labeling on alcohol. And that came out in 1989. Really, the alcohol industry caved and finally did it, even though the Congress never really passed the law for it. And I detailed all that in my book.
Yeah, I was waiting to get into the political ramifications of it.
Yeah, so we won't get into that right yet, but a lot of women didn't even know it was a problem to drink. And back in 1977, when the first FDA warning came out on alcohol, the guy, Ken Warren, who was at the National Institutes on Alcohol Abuse and Alcoholism here in Bethesda, he was the one who was tasked with deciding how many drinks a day is a problem. And believe it or not, at the time, he just arbitrarily came up with 6 drinks a day. And I interviewed him. I talked to him. And I said, "Why would you say that?" He said, "Because women were drinking so much that if I said less than 6 drinks, my phone would be ringing off the hook." And that's what he said. He was like deputy director of NIAAA for a long time. And I'm not throwing him under the bus. I'm just saying this was the fact of American society, was a lot of people drank. And that's really why when many of these death penalty cases were heard and we took them back and did appeals, the judge would say, "My mama drank too, and I'm okay." Meanwhile, he could have been a rocket scientist, or maybe he was the next Einstein. And instead, he ended up a judge. And no offense to him, he got well educated. But even Barbara Bush herself jokingly said about Junior, so George Bush Jr., that, "Oh, yeah, I drank a lot in my pregnancy. Why do you think he turned out like he did?" I'm not, and that's not a political statement.
No, and that's exactly the point that I'd like our audience to take away, is that the ramifications of the alcohol exposure may not be glaring. And so when you have FAS, fetal alcohol syndrome,
Right. It is the whole
that
thing.
is there's a facial, the frontal cortex is smaller, the eyes are more inset, correct?
The eyes can be wide set and they're smaller because the eyes are an extension of the brain. So there are 3 cardinal features. It's not anything to do with the prefrontal cortex, although that is hit by the alcohol. But it's small, wide set eyes, indistinct philtrum. So this little divot in between the nose and the upper lip is a little bit flattened. And the upper lip is thinner compared to the lower lip. Now, it turns out that a lot of Caucasians already have that. And that's because alcohol's been in the genome, in my humble opinion. It's been in the genome of Caucasians all the way back to the Vikings that raped, pillaged, and burned all across
Yeah.
North Europe, half of North America.
Yeah, the agricultural industry started with, you've got grain that's laying in the silo for an extended
Right.
period of time. You've got fruit, grapes, whatever, and it would just naturally ferment. The agricultural revolution,
Yes.
which took place predominantly in Europe, would have
Yeah.
introduced alcohol a lot earlier than
10,000 years ago. 10,000
than
years ago.
African
Yeah.
or some of the other cultures that later adopted agriculture. So you're right. It's a part of our genome in a lot of ways, this alcohol exposure, and it is so acceptable. And you mentioned about the judge. I find that interesting because it's not surprising, because like you said, a lot of these patients or people may be diagnosed with Asperger's syndrome. They may be a little antisocial. Maybe they're the bookworm, the nerdy kid who may have some developmental issues, but is able to function, is able to become very productive. However, what would they have been without the alcohol exposure?
And that's what I write about in my book.
Yeah.
Yeah. I write
Yeah.
about maybe Da Vinci would have never happened, or maybe Albert Einstein would have never happened had their parents drank. And if we go back and we look at neurodiversity in general, it is possible that the alcohol has influenced our society in such a way, our genome and our epigenome. It's really epigenetic changes that we now know are coming from the male sperm, and those can be passed for generations to come.
Right.
You can't get rid of it. Although
Now,
these
what are your
accumulation effects, people are showing that with good nurturing, because I know you talk a lot about nature versus nurture, and they've shown in mice pups that with good nurturing and licking, it's heavy licking in the mice pups. The moms who lick heavily can demethylate the DNA, believe it or not. It takes those methyl groups off. And so what would have been put on by the alcohol can be somehow made up for by really good nurturing. But unfortunately, a lot of children, especially until this whole trauma movement has come about, a lot of children were belittled, demeaned, yelled at, beat, hit, whipped, spanked. They were considered chattel for so many generations, and just parents could yell at them and do anything they wanted to. In fact, until the early 1900s, if a child died in a family's home, there was no Child Welfare League of America. Okay, that whole movement started late early 1900s, and we actually had animal welfare in this country before we had child welfare. Most people don't know that, but I write
Oh,
about that in my book. Uh,
I'm not, yeah, your book is amazing. It really does cover a wide range. Like I said, you go into the preconception societal issues, you go into the post-conception societal issues, you go into the neuroanatomy, you go into the social behaviors, and the book is extremely well done and very thorough on a subject which is very common, yet rarely talked about. And it's every time that I've mentioned your book a number of times to colleagues or friends or whoever, just for whatever reason. And as soon as I say it, they're like, oh, yeah, fetal alcohol. I'm like, no, it's a little different. It's the subtlety of it. Now, you started talking a little bit about you say there may not have been a Da Vinci if it weren't for alcohol. I've heard, forget what, maybe it might have been on like the Joe Rogan show or something where he talked about the stoned ape theory, that some of our brain development evolutionarily, some people attribute it to perhaps mushrooms or other toxins, which actually help to stimulate some of it. Do you have any thoughts on that?
I don't. I'm not going to
I'm
comment
not sure
because
how
I'm
proven
not
that
one of
is.
these people. I'm not one of these people that's into psychedelics, or I just think all the mess needs to be taken out of the equation. And let's focus for these children, at least, on the fact that there are three hits to neurodevelopment. The first being the prenatal exposures, and there are epigenetic changes as well. But if the father used, then those zygotes are going to be even more susceptible to the mother's use. So there's preconceptional and prenatal, but then if you have childhood trauma, so that's what we now know of as ACEs, adverse childhood experiences, but witnessing or experiencing abuse, and that was part of my master's thesis, showing that the link between those two things is two developmental hits. But then the third hit is adolescent onset alcohol, tobacco, other drug use. But if you start putting in ketamine and all of these things, in my practice, I follow kids for years because I'm child, adolescent, and adult boarded. So I follow them for years. And these people who go off, let's say traditional psychiatric medicines, and then are put on, say, ketamine or things like that, are at high risk of psychosis. So you have to be really careful as a psychiatrist or as a healthcare provider if you're going to be doing one of these alternative treatments, because you have to know that these brains are not the same as other neurotypical brains. At even certain psychiatric medicine, so a panel of us 12 international physicians wrote an article back in around 2014, I think is when it came out, but on the psychopharmacologic treatment. It's an algorithm for treatment of individuals who have fetal alcohol spectrum disorder. And I do want to introduce one other term, which is neurodevelopmental disorder associated with prenatal alcohol exposure. It's a really long term, but that's the one that we were able to get into the Diagnostic and Statistical Manual for physicians. So a lot of people are unaware of it, even in the medical community. But in 2013, when the new DSM came out, we were able to lobby and get that into the front end of all the neurodevelopmental disorders. It's
Yeah, that's
a
important to have in the government,
diagnosis and a
it's
code.
important to have, yeah, it's important to have a code for it. Okay, we're getting towards the end of our time, unfortunately. I know we had a lot to cover, and I'd love to have you back again. What is your bottom line message, I would say? Because I think for me, the understanding that you've given me in this is that just the awareness that alcohol is not an innocuous substance, despite its ubiquitous presence in our culture. And even though it's essential during COVID, it's not essential for, I mean, it's a
Health.
harmful,
I know it's not
it's a
essential for
harmful,
health.
it's a harmful
Yes.
drug. And you also have the big alcohol lobbying groups,
Right.
which influence policy at the government level. And if
Yeah.
COVID taught us anything, it's that mix of politics and finances, and health and wellness are not necessarily the government's first objective. It's
It's
economic,
money. It's the bottom
societal,
line is, yeah, they
right,
will open up
financial,
taxation
right.
for marijuana dealers are now legal because they want
Yeah.
to tax
Well, that's
revenue.
a whole nother that's a whole nother
Yeah,
can of worms
exactly.
that,
But I'm
you know,
saying that's an example of how the government really doesn't care about health. So I want to just emphasize that the main issue I want to get across is that the alcohol industry, big alcohol, has a duty to warn consumers, and it's never been held to that degree of accountability because the warning label that's on there is so tiny, it's minute, and you can barely see it. They offset the color of the label with the color of the labeling. And really, it focuses on pregnant women only. It says pregnant women should not use alcohol because of the risk of birth defects. But the problem is, you don't even know you're pregnant. So the true label should say sexually active alcohol consumers should use reliable contraception and should plan their pregnancies carefully to avoid any alcohol. If you're pregnant or planning to be, avoid any alcohol.
yeah.
Some group needs to get together and formulate a national campaign about this. The FASD United, the Fetal Alcohol Spectrum Disorder United, has tried over the years. I don't know that they've taken on that issue, but the problem is that special interest groups to the alcohol industry is they are
Yeah, they
notorious.
run the show.
Yeah, they are running.
Money and power rule over medical recommendations often, or science.
Right.
We're science influenced, but not science driven in a lot of these public policies. It's financially driven, it's power driven, all those things that come along with it. But thank you so much, Susan, for coming
You're
along.
so welcome.
How
Thank
can people how can people get a hold of you? And like I said, we can have you back again, because we could have spoke for 4 hours on this, and we have at various points on our phone conversations,
Yeah.
our personal conversations.
Well,
How can they get a
hey,
hold of you and get a hold of your book?
so the book is at www.prenatalalcoholexposure.com. And if they do buy through that website, it's through Lulu, and it's gives a little bit more to me. If you buy it off Amazon or any of those marketplaces, I get 2 cents for every copy. Just
Good for
so
you. You must be a billionaire by now, huh?
no, not at all. This book is not flying off the shelf by
I
any
know.
because people do not want to hear or about, much less read about a problem which affects so many people.
Yeah.
But so that way, and then I'm on LinkedIn, and I would suggest that if you want to get in touch with me, LinkedIn is a really good way. That's how I met Patty Casper and you and so many other people. My LinkedIn is Susan D. Rich, MD, MPH, and it's all one word. So Susan D. Rich, MD, MPH. And I would say those are the best ways to reach me. And I am not a psychiatrist that sees patients outside of the state of Maryland. If people in neighboring states see me, they have to come across the border and come to my office. I don't do telehealth internationally or even nationally. That's one thing to note. There are people out there like Jeff Noble, who's a FASD coach for parents and
Mhm.
affected individuals, and Patty Casper's another person who does FASD
Yeah. You
thing.
certainly could
I can't do that.
you certainly could direct a lot of people in the right direction, if nothing
Yes.
else. And
Yeah, absolutely.
a lot of your followers and your followees, and you're one of my followers and followees. If anyone's interested in learning more, the book is there. You can get a hold of either one of us and we can direct you in the right direction, the right people. So thank you so much, Susan. Good to see you
You're so
again,
welcome.
and you have a great day, and thank you. So
Thank
this has
you.
been a episode of the Ultimate Men's Movement associated with the Ultimate Men's Clinic in New Bedford, Massachusetts.